Have you ever wondered why your body feels weak, even when you're eating well and exercising regularly? You're consuming all the right nutrients and you're dedicated to your fitness regime. Still, you feel drained and you can't seem to shake off that fatigue. Well, there might be more to it than just being overworked or stressed. Sometimes the cause of such issues lies deep within our bodies, at the cellular level. The answer might surprise you. It could be a condition called aplastic anemia. Aplastic anemia is not a common term we hear every day, yet it's a condition that can significantly impact the quality of life for those who experience it. But what exactly is aplastic anemia? Let's break it down. Aplastic anemia is a rare, serious blood disorder that occurs when your body stops producing enough new blood cells. Now, think of your body as a bustling city. Blood cells are like the citizens that keep the city functioning smoothly. Red blood cells deliver oxygen, white blood cells fight off infections, and platelets help with clotting to prevent excessive bleeding. When aplastic anemia strikes, it's like the city's population suddenly drops, leaving vital roles unfilled. The lack of sufficient blood cells can lead to a number of health complications. Unexplained fatigue is a common symptom, and it's not the kind of tiredness you feel after a long day. It's an overwhelming sense of exhaustion because your body isn't getting the oxygen it needs to function efficiently. Another risk is that of increased infections. Without enough white blood cells, your body becomes an open field for bacteria and viruses, leaving you more susceptible to illness. Then there's the risk of excessive bleeding. Picture this: you get a small cut, but instead of forming a clot and stopping as it normally would, the bleeding continues. That's because your body doesn't have enough platelets to form a clot and halt the bleeding. In a nutshell, aplastic anemia is a condition that, due to a decrease in new blood cell production, can leave you feeling constantly fatigued, more prone to infections, and at risk of excessive bleeding. It's like a city trying to function without its citizens. Understanding aplastic anemia is the first step towards recognizing its symptoms and seeking appropriate treatment. It's about knowing what's happening in your body and being proactive in maintaining your health and strength. Now, you might be wondering what causes aplastic anemia. Well, aplastic anemia is a bit of a medical puzzle. In many cases, the cause remains unknown. It's like a detective story with missing clues. However, we do know about some factors that can trigger this condition. Let's start with the heavy hitters: radiation and chemotherapy treatments. These save lives by killing off cancer cells, but they can sometimes be a double-edged sword. The same treatments that target cancerous cells can also damage healthy ones, including those in your bone marrow responsible for blood cell production. This can lead to aplastic anemia. Next up, we have exposure to toxic chemicals. Certain industrial chemicals, like benzene, have been linked to aplastic anemia. So, if you're working in environments where you might come into contact with these substances, you could be at risk. Certain medications can also play a role. Some drugs, including those used for rheumatoid arthritis, and some antibiotics, can occasionally lead to aplastic anemia. It's vital to remember that this is rare, and your healthcare provider will always weigh the benefits of a medication against potential risks. Autoimmune disorders, where your body's immune system mistakenly attacks its own cells, can also cause aplastic anemia. In this case, the immune system targets the bone marrow cells, hindering their ability to produce new blood cells. Lastly, certain viral infections can lead to aplastic anemia. These include hepatitis, Epstein-Barr, cytomegalovirus, and HIV. It's not entirely clear why these viruses can cause aplastic anemia, but researchers are working tirelessly to unravel this mystery. It's important to note that these factors don't guarantee you'll develop aplastic anemia. They simply increase the risk. And remember, in many cases, the cause is unknown, which is why ongoing research in this field is so vital. Knowing the causes can help in preventing or managing the condition effectively. So, stay informed, stay vigilant, and consult your healthcare provider if you have any concerns about aplastic anemia. But how do you know if you have aplastic anemia? That's a crucial question. Just like many other health conditions, aplastic anemia often presents a set of symptoms that could indicate something is amiss with your body's blood cell production. One of the first things you might notice is a sense of fatigue. This isn't just feeling a bit tired after a long day, but a persistent exhaustion that doesn't go away with rest. This happens because your body doesn't have enough red blood cells to carry oxygen to your tissues, leaving you feeling worn out. Shortness of breath is another common symptom. It's like running a marathon without actually moving. Again, this is due to a lack of oxygen-carrying red blood cells. Without enough of these, your body has to work harder to get the oxygen it needs, leaving you gasping for air even after minimal exertion. Next, we have skin paleness. This isn't about losing your summer tan, but rather a noticeable lightening of the skin. This can happen because the reduced number of red blood cells in your body means less blood flow to the skin, causing it to look paler than usual. Now, let's talk about infections. If you have aplastic anemia, you may find yourself getting sick more often. This is because your body's white blood cells, which fight off infections, are also decreased in this condition. This can result in frequent or severe infections that seem to take longer to recover from. Unexplained bruising or bleeding is another symptom to watch out for. This is due to a low platelet count. Platelets help your blood to clot, so without enough of them, you might notice that you bruise easily or bleed longer than normal. And finally, dizziness. This can occur as a result of less oxygen reaching your brain due to the low number of red blood cells. It's important to note that these symptoms can also be caused by other medical conditions, so a proper diagnosis is essential. So if you're experiencing any of these symptoms, don't hesitate to seek medical attention. Your health is worth it. So what can be done if you have aplastic anemia? This question is likely on the minds of many who are dealing with this blood disorder. The good news is there are several treatment options available, each designed to address the unique needs of the individual patient. One of the most common treatments for aplastic anemia is blood transfusion. This procedure involves receiving healthy blood from a donor to replace the blood that your body can't produce. It's a bit like getting a fresh supply of fuel when your tank is running low. While blood transfusions are not a cure for aplastic anemia, they can help manage symptoms and improve quality of life. In some cases, a more intensive approach may be needed. This is where bone marrow transplantation comes into play. The bone marrow is the factory where blood cells are produced, and in aplastic anemia, this factory is not working as it should. A bone marrow transplant replaces the faulty factory with a healthy one from a donor. This can be a challenging procedure with potential risks and side effects. But it's also the only treatment that can potentially cure aplastic anemia. Another treatment option is medication that encourages the bone marrow to produce more blood cells. These drugs, known as growth factors, work by stimulating the bone marrow to ramp up production. Imagine it as a motivational pep talk for your bone marrow, urging it to get back in the game and start making those vital blood cells again. Of course, treatment for aplastic anemia is not just about addressing the immediate problem. It's also about regular monitoring and supportive care. This might include regular checkups to monitor your blood counts, medications to prevent infections, and lifestyle changes to help manage fatigue and other symptoms. Managing aplastic anemia is like running a marathon, not a sprint. It requires a comprehensive and long-term approach, involving not just medical treatments, but also dedicated self-care and support from healthcare professionals. The bottom line is, while aplastic anemia is a serious condition, there are effective treatments available. The best approach depends on the individual patient's overall health, the severity of their aplastic anemia, and their personal preferences. With the right treatment and management, aplastic anemia can be effectively controlled. So, if you or a loved one are facing this condition, take heart. While the road ahead may be challenging, with the right support and treatment plan, you can navigate this journey and maintain a good quality of life. Aplastic anemia might sound overwhelming, but understanding it can make a big difference. In the past few minutes, we've journeyed through the complexity of this condition, breaking it down into digestible parts. Aplastic anemia, as we've learned, is a serious blood disorder where the body's bone marrow doesn't make enough new blood cells. It can be caused by a variety of factors, including certain medications, radiation and chemotherapy treatments, exposure to toxic chemicals, autoimmune disorders, and viral infections. The symptoms, such as fatigue, shortness of breath, rapid heart rate, and prolonged bleeding, can be quite debilitating. However, hope is not lost. There are numerous treatment options available, ranging from blood transfusions and stem cell transplants to medications that encourage the bone marrow to produce more cells. Remember, knowledge is power. The more you understand about aplastic anemia, the better equipped you'll be to manage or help someone manage it.